Bonjour à toutes et tous, and good morning to everyone, and welcome to part 3 in our Social Environments for Health webinar series, Health Equity Focused Social Prescribing. My name is Andrea Bodkin, and I am the moderator for today's session, and I am a Senior Program Specialist in Health Promotion here at Public Health Ontario. I am coming to you today from the downtown Toronto offices of PHO, on Treaty 13, lands associated with the Toronto Purchase of 1805. Today, we have people joining us from across Ontario and Turtle Island. I'd like to acknowledge the history of this territory, the First Nations, Inuit, and Métis communities who have lived and worked and loved on this land for more than 10,000 years and are still here. I'd like to acknowledge their continuing endurance and resilience. As I mentioned, this webinar today is the third in our series on social environments for health. We had the first two webinars earlier in January, and those recordings will be posted quite soon. You can also read our focus on, and we're going to pop the link for you into the chat so that you can read and download that resource. So the focus of our session today is on health equity focused social prescribing. We're going to begin the webinar with a short presentation on the topic, and then we're going to have a bit of a fireside chat with our three speakers, and then we'll have our Q&A session. As I mentioned, you can use the Q&A pod anytime to ask questions. I'm so excited to introduce our incredible speakers for today: Natasha Beaudin from the Alliance for Healthier Communities, Ali Hedge from Harrow Health Center Family Health Team, and Amanda McConkey from the Community Health Centers of Northumberland. Natasha, I can't wait for your presentation.
Good morning, everyone. So I will introduce myself. Bonjour, je m'appelle Natasha Beaudin. As Andrea mentioned, I am the Social Prescribing Lead with the Alliance for Healthier Communities. And just in case you're not familiar with my organization, the Alliance for Healthier Communities is a network of over 120 community-governed, comprehensive primary healthcare organizations across Ontario. It includes community health centers, nurse practitioner-led clinics, Indigenous-led primary healthcare, and community family health teams. These organizations share a commitment to advancing health equity through the delivery of comprehensive primary health care. They serve populations systemically marginalized and underserved by other parts of the health system, and those who face the greatest barriers to health and the poorest health outcomes. These organizations are team-based and typically deliver a range of clinical, allied health, health promotion, and social and community support services. The work of Alliance members is grounded in the principles of our model of health and well-being, and our Indigenous-led primary healthcare organizations use the holistic model of health and well-being. So our social prescribing model is rooted in health equity with a focus on enhancing collaboration between primary healthcare teams, health promotion, and community development to promote integrated and coordinated care delivery. So this model is the foundation for all the work we do, including our social prescribing. So I want you to take a moment and just think about something that supports your health and well-being that is non-clinical. Is there something that brings you joy or brings meaning to your life? And just take a moment and think about that. So some people might say spending time with my family, going for a walk with my dog. Maybe for some people at this time of year, it's cross-country skiing or snowshoeing, or maybe for some people at this time of year, it's staying indoors, being cozy and having hot cocoa, but just reflecting on all of those non-clinical things that support our health and well-being. So now that you've had a moment to reflect, it brings me to the social determinants of health. So when we look at the social determinants of health, things like income, education, gender, race, racism, colonialism, all of those elements, those are the conditions in which we are born, grow, work, and age, and they are huge determinants in our well-being. So thinking even about social exclusion, community belonging, food security, those are the social determinants of health, and they have a big impact on our health and well-being. And the aim of our health equity focused social prescribing is to address many of these factors by providing social and community supports, in addition to building trust with clients who might not even have regular access to primary health care. So this is the Ontario Health Social Determinants of Health Framework, a great tool to use. And I'm proud to say that the Alliance was able to contribute to this document. And one of the things that we do at our member centers is collect determinants of health and race-based data in order to improve health outcomes. So there's a lot of different ways to implement social prescribing, and it can look different in each community. But we identified 5 key components between primary care and the community-based supports. The first step is centered on the client as an individual with their own social and medical needs, their own interests, their own goals, and their own gifts to share. The prescriber is a healthcare provider with a trusted relationship with the client and is the key to leveraging healthcare appointments as an opportunity to identify underlying non-medical issues and making a social prescribing referral. When people experience poor health, sometimes a provider might be the only trusted relationship the client has. So when you think about people who've had that long-term relationship with a family doctor or nurse practitioner for 15 years, that might be the longest relationship that person has had, and they become a very trusted connection for the client. But a healthcare professional is not generally the best suited person to address social need. This is where a navigator, a link worker, a health promoter might come in. The social prescribing navigator catches the referral with a warm handoff from the provider and connects the client to appropriate resources based on self-identified interests and needs. And then we have the actual non-clinical prescriptions. So this could be a social connection, like a coffee drop-in. It could be food security, like connecting someone to a good food box or a community garden or a food bank. It could be nature-based activities. It could be income, transportation, data equity, so connecting someone to the internet, helping people join a bereavement group, or something to help them connect with their own culture, culture as medicine. It's a very wide range of potential activities. And then finally, there is a data tracking pathway that follows the client's journey throughout the social prescribing process. This enables the integration of lessons learned in real time to enhance quality of care, delivery, and monitor outcomes. So I'll tell you a little bit about our journey at the Alliance for Healthier Communities. So we started in 2018 with the social prescribing pilot. So this was implemented in 11 CHCs across Ontario, and they were a mix of rural, urban, francophone, northern, and we were looking to the model of social prescribing that was being delivered in the UK. And because of the diversity of the communities, social prescribing looked a little different in each of the 11 centers. So it was adapted to the particular resources and needs in each region. In 2021, we started Links to Wellbeing, Social Prescribing for Older Adults. And this is a partnership with the Older Adult Centres Association of Ontario. This project is designed to help connect socially isolated older adults with seniors active living centres across Ontario, as well as other community organizations. So at the moment, we have over 100 senior centers and over 200 healthcare organizations together in this partnership. And we're really working on trying to make that seamless referral from healthcare settings to community settings. In 2022, we started Black Focused Social Prescribing. So this is a social prescribing model that is grounded in Black and Afrocentric values and principles with a focus on supporting families and children. So making social prescribing culturally safe to improve health outcomes for Black people in Ontario. We're currently working with 4 sites across the province, and we're hoping to spread and scale this work to additional sites in 2025. Social Prescribing for Better Mental Health is another project that started in 2022, funded by the Public Health Agency of Canada. So we worked with 28 sites across Ontario to improve social prescribing pathways. We are developing resources and tools. Sorry, we developed resources and tools that can be shared and used by sites, such as screening tools, intake forms, templates, client surveys, as well as forms that can be used in the EMR. And through this project, we were also able to design social prescribing, health equity focused social prescribing online learning modules, which are available for free on our website. So we have 10 modules about how to implement social prescribing. I'm going to do a little bit of a closer look at social prescribing for better mental health. So there was 5 key objectives to this project, which was an 18-month project. The first objective was to train service providers to implement social prescribing with a health equity lens. We did so by engaging providers in monthly focused coaching meetings and learning events, and we worked with about 284 different providers across the province. Our second objective was to identify individuals at risk of poor mental health. We updated our electronic medical record screening tools to include clinical assessment tools that scored loneliness and well-being over time. Our third objective was to navigate individuals to the most appropriate services. So we worked alongside 211 Community Connection to deliver a closed-loop referral pathway. Participating centers also made client referrals to internal and external programs, which were documented in the EMR. And then we were our fourth goal was to co-design and engage, evaluate, and share impacts and lessons learned. So we had 28 sites across Ontario. So here's a map of where our sites were located. And those sites received funding and focused quality improvement coaching to implement a social prescribing pathway at their center. An additional 13 sites participated in a 12-week spread and scale learning collaborative. And so out of these centers, again, there was a huge diversity of different kinds of centers. So 4 Francophone centers, 2 Indigenous-led primary healthcare organizations, 4 family health teams, and 2 nurse practitioner-led clinics, as well as community health centers. Now I'll zoom out a little bit just to give you a little overview of some of our results from all of our projects. So in 2018, with the pilot project, we saw how social prescribing can improve well-being, decrease feelings of loneliness, and these effects continue to scale up as more Alliance members built their own social prescribing pathways. So we saw this 49% decrease in loneliness, 12% increase in self-reported mental health. And the place where we saw the greatest improvement in self-reported mental health was when clients were given an opportunity to become a volunteer, take on a role, become a peer leader. So that opportunity to give back or have a role, no matter how small it was, people having a role had a really good impact on their self-reported mental health and a 19% increase in social activities. After the first 3 years of Links to Wellbeing, we had worked with about 1,500 or more older adults across Ontario. And at 9 months, 40% of them reported improved connections to community and better mental and physical health, and a 62% decrease in loneliness over 12 months. And then with social prescribing for better mental health, we saw the deepening and expanding community relationships, as well as using an asset-based community development model was important. As one staff member told us from this project, we have to think about what is strong in our communities instead of what is wrong in our communities. So we worked with almost 3,000 clients over 18 months. 90% of the clients reported improved well-being after attending community programs and activities. 84% of professional service providers agreed that social prescribing helps address clients' complex needs, and 72% of clients who experience barriers receive support to help them attend programming. And I'll just say with social prescribing, sometimes when I'm talking to clinicians about this kind of work and I talk about some of the non-clinical programs and services, sometimes there's a little bit of resistance to the idea, like, how is this helping my clients' health? Or conversely, sometimes people say, I've always been, when I was working as a health promoter and I was delivering a stress reduction program, and the clinicians would say, I always tell them about your stress reduction program. I tell the clients about it. I say, here's the poster, you can go down the hall. The difference with having a formal social prescribing program is then it's entered into the electronic medical record, it's documented, so that way a clinician can make that formal referral to, let's say, a stress reduction program. They can see through the EMR that the client attended all all 10 sessions of the program. And then when the client comes back for their annual checkup, the clinician can say, oh, I went through the client came for the checkup, and it was so much smoother because their anxiety was so greatly reduced. We were able to get through it faster. Okay, I really do see the benefit of some of these programs and the fact that they know what caused that reduction in anxiety. So that's just one example of how we see that more formalized way of using social prescribing can actually support clinicians to have better a better experience in their work. It allows them to focus on the clinical aspects that is their area of expertise, and having that link worker or health promoter support some of those non-clinical issues and addressing them, it really helps everyone's workflow become more manageable. And then here's a snapshot. We're just at the moment preparing our final report from Black Focus Social Prescribing, but I have a snapshot of some of our results. Um, so we saw that the most common social prescriptions at all 4 sites were in order. Food security was number 1. People are struggling to put food on the table across the province. Um, the Black focused community events was number 2. Arts activities was number 3. Connections to other programs and services was number 4. And then followed by physical activities and social programs. So in the past year, 88% of survey respondents who were clients of Black Focus Social Prescribing were worried about running out of food before they had money to buy, either often, more often, or sometimes. In the past year, 40% of survey respondents reported not being able to afford balanced meals often and sometimes. And 87% of survey respondents agreed that Black Focus Social Prescribing made food available to them. So that's a little bit of some of our results from our evaluations. And now I'm going to turn to what does social prescribing look like in practice. So here's an image from Taibu Community Health Center in Scarborough. And this is an image from a nature walk or a hike. So that could be one idea of what social prescribing looks like in practice, helping people get out of the city and get in touch with nature. And here's another image of what social prescribing could look like in practice. So here is an event that we attended at Black Creek Community Health Center in October. So it was a health fair with food, with music, but also you could get your blood pressure taken, you could be screened for diabetes or other things. And there was also prizes. There was a beautiful Black History quilt, an art project that was being um, revealed that day. So there was a lot of reasons why someone might want to come to this fun activity. And health was part of it, but there was also other social connection and other reasons for people to come to this activity. And that's something we've found with the Black Focus Social Prescribing. At first glance, maybe a hair drop in, getting your kids hair braided or hair cut might not, like, there might be a little bit of a disconnect. How does that connect to our health? And then we talk to clients and they say, I wasn't actually leaving the house because I couldn't afford to get my hair cut, and I just did not feel good with how my hair was looking. And then someone told me about this hair drop in, and I went. And not only did I not have to explain about Black hair, the hairdresser knew about my home country. She knew my culture. For the first time since coming to Canada, I felt at home. And that was a really good feeling. And then as I talked to the community navigator, she told me about some food security programs, and that was really something that could really help my family and myself. And then as I got to know that connector more, she was able to connect me to primary health care, and I was able to get some of my health needs addressed. So this way of working has a lot of different kinds of successes. Here's another example of what social prescribing might look like in practice. So I have a picture from Lakeshore, nurse practitioner-led clinic in North Bay, and Linda at the community garden in Seaway Valley in Cornwall, so that health promoter, that link worker, that navigator can sit with the client and ask the client what matters to you and kind of get at what is missing from their lives that they need a little support in connecting with. And food security is another top one. So I wanted to take a stab at thinking about what social prescribing might look like in a public health practice. So I don't work in public health, but these are some examples that I thought might resonate for some members of the audience. So a nurse is completing a well baby checkup. During the course of the appointment, the nurse realizes the client and her family are food insecure. So that might be knowing what food resources are in the community or connecting your client to someone in the community who can connect them to those food security resources. Maybe a client is attending a Healthy Smiles dental checkup. The parent mentions, wow, my kid is so high energy, we can't afford recreational programming, but this kid would love to do basketball, or this kid would love to learn how to skate. Is there a way to connect them to a subsidy for recreational programs? Is there someone in your municipality who you can make that connection to help get that kid into the recreational programs that can support them? A diabetes dietitian is meeting with the client. The client says, every time I meet with my doctor, they tell me I need to exercise, I need to be more active, and I just have no motivation. Okay, is there a walking group? Is there some kind of group that has a social connection that might help that client? Those are just ideas off the top of my head, but just ways that we can start thinking in bringing a larger lens to our clients. So here's another few ideas about how social prescribing could look in practice in a public health setting. So facilitating partnerships, building networks between healthcare and community organizations at a regional level, including identifying populations who might most benefit from social prescribing, those who face the greatest barriers. Training and capacity building. So that could be building in some health equity training for staff and volunteers at community organizations who receive those referrals. Providing funding and resources. Maybe that's screening tools. Maybe that's grants to address gaps in community programming. Advocating for policies that integrate social prescribing into healthcare systems, and monitoring and evaluation, measuring the impact of social prescribing at a regional level. Those are my ideas. You may have different ideas. We do have a social prescribing community of practice, and there are quite a few public health units that have joined our social prescribing community of practice and have actually created their own community of practice to talk about how social prescribing can be implemented. And I have to give a shout out here. I had a wonderful conversation with Lindsay O'Donnell at Huron Perth Public Health Unit, and they are beginning some of this work, especially with mobilizing partners, convening tables to bring partners together, seeking out existing partnership tables where social prescribing work could fit in, sharing best practices and evidence related to social well-being and social prescribing with partners. So there is a way that this can really fit in very nicely with work that's being done in public health. And I wanted to share also, if you're interested, if this is resonating for you and you'd like to deepen your knowledge of social prescribing. So the Alliance has worked with the Center for Effective Practice to develop a tool for how to embed social prescribing in clinical practice. So you can scan this QR code to access the Center for Effective Practice tool. And I really love community gardens, so I think I put that picture in twice. We also created 5 very short, less than 5-minute videos profiling social prescribing in 5 different settings across Ontario. So you can use this QR code to access our 5 videos. So there's Regent Park in Toronto, as well as Santa Sante, Hamilton, Niagara, as well as the Seaway Valley, Taibu, and Lakeshore Nurse Practitioner-led clinic. So you can see what social prescribing looks like in 5 different settings. And we do have quite a few learning events. So this is one of our in-person community of practice sessions. And if you would like to get more involved, so we have our Ontario Social Prescribing Community of Practice. It meets virtually every second month. There's also a National Social Prescribing Community of Practice, which is convened by the Canadian Institute for Social Prescribing. And we have these, well, now there are 10 health equity focused online learning modules on our website. You can email to register. It's free at the moment. And all of that information for how to register for the communities of practice or how to sign up for the online learning modules is available on our website. And we do have some final reports to share from our work. So our first 3 years of Links to Wellbeing final report, our Social Prescribing for Better Mental Health final report, and we also have this great document called Link Workers Work, and it's really lays out some of the benefits of having a link worker or using social prescribing and some of the benefits that organizations and clients and staff can experience through having a link worker and using social prescribing. And that brings me to the end of my more formal part of the presentation. So thank you very much. It's really something that's, I'm very passionate about social prescribing, so I'm always happy to talk with different audiences about this work. And we're going to shift over to a bit of a fireside chat. So when we talk about social prescribing in practice, I thought I would invite a couple people who are doing this work every day to share from their own experiences. So here we are in our cozy fireside chat. So welcome, Amanda. Welcome, Ali. Thank you for joining me beside my cozy fireplace. And so I kind of gave a little bit of a general overview about what social prescribing looks like for Alliance members. But why don't we start off by just some introductions? So who are you and what led you to social prescribing? So maybe I'll start with you, Ali.
Yeah, so I'm Ali. I work at the Harrow Family Health Team. We're pretty Southern Ontario. We're the most Southern Ontario down here. I am the link worker here at the Family Health Team. My background is in social work. I have my MSW and my BSW in social work, which for me comes in really handy in my position. I've been working at the Family Health Team here in Harrow since February of 23. With the support of the Alliance, we were able to have that position started, and then we've now continued it since that program ended. So it's been a really positive experience here for the clinic. I think, what kind of brought me into social prescribing?
Exactly.
So I grew up in Harrow. I'm very familiar with the area. I've spent most of my professional practice working in or around our small community, and working with individuals in poverty, dealing with housing, things like that. So when the position came up for link worker here in the Harrow area, I thought, well, this seems like a perfect fit for me because I have a lot of passion for bringing the community the needs that the filling the gaps in our community, right? I've seen a lot of it in my practice, and I really want to make sure that our community isn't getting kind of left behind, for lack of a better word. So that's what brought me here.
That's beautiful. How about you, Amanda? Who are you and what brought you to social prescribing?
Yeah, so I'm Amanda McConkey. I am at the Community Health Centers in Northumberland, and I've been working here for just over 13 years. I was a community health worker when I first started here, and then I am now the community health promoter. I have been working in community health for 18 years or just over 18 years. I previously worked in Oshawa. What led me here was just, I think I've always had a passion, one, for working with individuals, so children all the way to older adults. I've always been involved in community programming or running different types of programming for children and youth. And so when I got involved in community health centers 18 years ago, I just loved that model of care. And I think we've always done, as I know you said, kind of, Natasha, we've always done social prescribing. It's just, it's never been a formal process, right? It's never actually been documented. So when I saw that the Alliance was doing this work and they were trying to formalize this great work and showing the great work that exists, I just kind of jumped on it for our center. So I kind of, put that forward and was allowed to kind of lead that initiative here at our center to kind of get things rolling. So that's kind of, what led me there.
Amazing, amazing. And so, Ali, what does social prescribing look like in your context?
Yeah, so here I'm at a family health team. So I work one-on-one with patients of the clinic. They can be referred to by their practitioner or any provider here within the clinic, or they can be self-referred if they happen to see my flyer floating around while they're at an appointment. So they may reach out to me. I'll work with them one-on-one on developing some of their goals, meeting some of their needs, and that can be a variety of things. I connect them to resources based on the conversations that we have. And like I said, a variety of different things, which could be basic need resources, mental health resources, social connection resources, physical activity resources, you name it, I probably have a resource for it, or I could look for one. So that's what that one-on-one looks like. And from those one-on-one appointments, we had kind of discovered that there's not a lot of social activities in Harrow. It's not a shock to me, but there's a lot of barriers for our community to leave to go to some of these activities outside of our community. So what we did was we were able to start incorporating social activities here in the clinic. So I oversee currently 4, but we are expanding our activities that include like a social coffee hour. We have a chair yoga group that comes in. During the nicer weathers, we do a walking group. So that it kind of developed from there. I've also partnered and reached out to different organizations to bring their programming here. So we've partnered with like the Alzheimer's Society can now come in and they offer their programming here. Same as our youth wellness hub in the area uses our space. We're fortunate enough to have space that they can use, so we can partner. So that's part of what that looks like. And in addition, like I said, building those connections to other community organizations to see where we can partner, what supports we can offer patients in the clinic. The other nice thing about our social activities, it's not just for the patients. We've expanded it to all of our community. Again, not just Harrow, but really, if you're willing to come here, we want you here.
I'm getting in the car right now. I'll be right there.
We really wanted to hit home that like our clinic has a lot of history in our community, and we really wanted to expand that and offer it to everybody. We're trying to build this sense of community, and by opening it up to everybody, it's really been a positive experience.
That's amazing. How about you, Amanda? What does social prescribing look like in your context?
Yeah, so I mean, prior to really implementing this process of social prescribing, we have, and we always have had lots of social programs, cooking. So it used to look like a provider would just leave a sticky note like on our desk. Could you connect with this client? They might be, they need food support, or they should try the chair yoga. So it was kind of done that way. And then as we've moved into kind of making more of a process for social prescribing, there's kind of a few different layers. So we've been lucky that we had received some grants and funding to hire a community connector. So that has been great. And their role is kind of similar to what Ali was saying, where they work one-on-one with the clients. What are their goals? What are their needs? So they'll connect them to internal programs here or external programs and that we partner with as well, and anything kind of in the community. And we'll look at those barriers. So like, what can we do to help navigate or eliminate barriers for this client to access that? And it can look anything from, okay, we have some, community care has funding for transportation and we're able to connect them to that. Or our community connector will go with somebody who's maybe having some anxiety and will attend that first session at a senior active living center, even with the client, to just so that they feel comfortable going. We also have an interdisciplinary team that sits on a social prescribing committee. So we have staff from all departments, from primary care, diabetes, and we all sit together and kind of have been developing and planning what this looks like at our center. Because one big thing, as you were saying, Natasha, is we never documented this work. So we have developed a process in our EMR that allows not only community connectors to document their work, but also providers who are doing social prescribing work on every day, so that we can capture and pull that data to see where are the gaps, what are the top, social determinants, kind of end codes. So like social isolation or food insecurity, poverty, like what's going on in our community, that we can help to kind of maybe develop or kind of look at ways that we can kind of support people with that. So it's just really great that we're kind of implementing this kind of full approach. And the community connector, they work in this very circle of care approach too at our center, where it's not just all on the community connector. We try to make everybody kind of available to help, and we do regular check-in calls. So if a provider is, say, giving that info, as you said, to their client, but maybe won't see that or know, they can send us a check-in and say, hey, could you just follow up to see if this client needs further support or connection, or are they good and they've been able to connect to this support?
And I'm curious about that interdisciplinary team. Like, do you feel that social prescribing has helped bring sort of disparate teams together to collaborate more?
Yeah, and it's been really good to have perspectives from like the nurse practitioner or our diabetes dietitian, because they're the ones also doing the work. So it's like, I can't decide for them that this is the easiest or best process. So it's been really great to have, like, we'll create something and then we get the input from them and they're like, no, that's too much, right? So it's like, they don't want more paperwork to do in the EMR. So how do we make this as simple as possible, but capture all that information and data? And like you said, when they attend programs here, when we're doing work, they can also see that in the client's chart. So they can look back and go, oh, I see that you've been accessing our food cupboard, or you have been coming to the cherry yoga. Like, that's great.
Yeah.
So yeah, it's a nice holistic rounded way of care for our clients.
Amazing. Ali, I was wondering if you have any powerful examples or a client story to share about the impact of this work?
I have a few, but I get to work one-on-one frontline with clients, so I see it a lot. But one that kind of always hits home for me is in our coffee social. We have a woman who attends who's in early onset dementia. And when she came in, she was really struggling. Her husband had mentioned, some concerns. And they have attended almost every single one of our coffee hours since August of 23. And she and her husband have both reported that, like, first of all, her mood is definitely picked up. They have things to look forward to. They're very excited to come and connect. They have different couples that they connect with within the group, as well as her memory doesn't seem to be getting any worse. And she is having some more good days than bad, is what they're reporting to me anyways. On like a more one-on-one basis, I've had one client in particular who ended up connecting with an outside social activity, and then kind of reporting back to me, like, she's feeling a lot better. She's feeling really good. The depression, the loneliness seems to kind of be subsiding. But in addition to that, she was letting me know, she's like, thank you so much for making me not feel like a number, right? Calling and checking in on me, like, that really, it meant not only did it mean something to her, but also it really encouraged her, like, okay, Allie's gonna call me. I'm gonna go out and do this so I can tell her about it, right? And by kind of that little encouragement, that little push, that feeling kind of important, for lack of a better word, it encouraged her to kind of take those next steps. And I don't work with her anymore. She's doing great. Last time I checked, and she was very happy with the services that she got connected with, and how she was feeling now.
Right, that feeling of being seen, being heard, being part of a community, that feeling of I matter, like it's invaluable, right? And that's amazing that this work can bring that feeling to someone. How about you, Amanda? Any powerful stories to share with us today?
Yeah, and I just want to say, like what Ali said, I think that's such a huge part. Like, so many clients, the fact that they know they can just call you and like connect with you. And you're like, yeah, just call if you need something. Like, I think that's been such a, it's like a weight lifted off some clients where it's like, oh, I'm going to call and they're actually going to call me back, or they're actually going to answer the phone, is so huge to know that they just have that person that's going to listen and be excited with them too when they accomplish things. But yeah, we've had a number of different stories, but one that comes to mind is we had someone who wasn't even really a client of our center, but they came to access our food cupboard. Their wife had recently passed away, an older gentleman, struggling. And really he came in because he couldn't figure out the cell phone. He didn't know how to use it. So we ended up connecting him to our community connector because we do some digital equity support. And we have a volunteer that helps clients with that as well. And then it snowballed. It became like he has all these medical things. He's trying to get to appointments. He has this going on and this going on. And he had a lot of mental health struggles going on too. So it just kind of snowballed from there. But with the support of the community connector, knowing he could come into our center and talk to us, he slowly got connected to some things. And he recently has started coming to our collective kitchen program. At first he was like, I'm just here, I'm not doing anything. And I'm like, okay, totally fine. But I've noticed as he keeps coming, his confidence has increased. He's doing it and being like, no, I know how to do this. And I'm like, oh, okay. Talking to people, getting to know other people, and just knowing he can call and touch base. So it's just great to see. When I think of him, when we first met him, we were really concerned and really like, our community connector was genuinely worried that like she was going to call and he was just not going to answer. Like, and just to see that this connection and him being able to know we can come in here and now getting connected to programs, it's so essential to someone's overall health, just that connection piece.
Yeah, and seeing someone flourish, right? Who was really struggling. I think that's so rewarding. Like that, I'm sure that's rewarding work for you as well. I think about a client when I was working at my community health center. There was a client that had like a standing appointment booked with her physician to talk about loneliness. And the physician was like, I'm not really sure how I can help with this. That client got a connection to the link worker and got some social prescription connections. And then the client was calling the doctor and saying, I'm so sorry, I don't have time to chat this week. I'm too busy. I have coffee drop in and I'm going to walking group. And so that's kind of what you want for some of those non-clinical programs, right? You want to free up the clinician's time so they can really focus on what they do best. I just maybe one more question. Wondering if there's people attending this webinar and they're not quite sure where to start. So I'm kind of shifting the questions a little bit, but like, how would you start if you're feeling a bit limited with budget or not quite sure? Do you have any ideas about where, like, some easy steps to kind of get started with social prescribing? I don't know.
Yeah, I mean, I can jump in.
Jump in. Yeah.
I mean, I think one is like you just shared, like the community of practices have been, and I'm sure Ellie would say the same, like so helpful because you also can connect to other organizations that are local or more local to you and have those conversations. I think another place is your Ontario Health team. Like, what are they doing? Do you have like, are you sitting on that? Are there like, what's kind of going on with that? Do the course that you guys have. It will really give you a nice overview. And I think just seeing like what committees exist in your community already and like just do a dive into like what's already happening before you try and restart any kind of wheel. Like if there's already stuff happening, how can you elevate it as opposed to just like trying to start new stuff? I would say that's probably where I would start.
Excellent. How about you, Allie? Any thoughts?
I mean, I really echo what Amanda has said. Those are really great places to start, especially when you're kind of very new to what's been going on. Something else that I may add is now that I've thought about it, it's gone. Sorry. But connect. Oh, there it is. When like we're really fortunate here at the clinic to have my role as the link worker as like in person. I think one of the questions may have come up about like, you know, what if what if we can't get a link worker?
Mm.
There are other organizations that are doing similar things that you may be able to refer to. The nice part about being within the clinic for me is that I can keep that loop closed, right? Really follow up with the providers, but that doesn't mean that other link workers, other community navigators that exist can't be really beneficial. I'm thinking specifically of, I'm working with the OCO, so the Ontario Caregiver Organization, and they now have a link worker role. So if the provider is noticing that, you know, their client is, or their patient is a caregiver and they could really use some additional supports, you can refer to the OCO, right? And have their link worker do some of this kind of more in-depth one-on-one supports, right? The links to well-beings is another one that I often refer to, right? Because they have similar positions to help, I mean, with seniors, right? So they're definitely more of a niche, right? OCO works with caregivers. Links to Wellbeing is more senior oriented, but there are other ones, kind of have to find them. But they do exist. And 2-on-1 Community Connect is also a really big resource that I know our clinic was using before the link worker role came into effect.
Super. That's amazing. And I guess like just start where you are. Start small and you can start social prescribing with just small steps. So I think we're going to shift over to the Q&A portion. So I know there are some questions in the chat and we are here to answer them.
We have so many great questions, but before I start putting them out to the three of you, I just want to say thank you so much, Natasha. Your presentation was terrific, and it's so good to hear all of these concrete examples from Ali and Amanda, who are actually doing this work on the ground every day. So here is our first question, and we've actually had a couple of people ask this question. What about all of these folks in Ontario who do not have access to a primary care practitioner or physician? Can they access social prescribing?
Well, maybe I'll tackle that first. So when I was working at a CHC as a health promoter, we had some programs that were just for our rostered patients, and a lot of our health promotion programs were available to people in the community. So as a health promoter doing smoking cessation and physical activity and stress reduction, you know, I would get community referrals, and as long as we didn't have a wait list. So that was one way actually for community members to work with our social prescribing programs and address some of those social determinants of health. It does not replace primary health care, but people were able to get some of those social determinants of health supported.
Yeah, I mean, same here. And individuals, if they come to any type of program, so it doesn't have to be necessarily primary care, they could just come to the food cupboard or an exercise class, and they can still get referred to our community connector that way. We would like, but due to capacity funding, our goal in the future is to connect with other agencies like the hospital and things that we can open up referrals to external. It's just right now we're trying to advocate for these types of roles and trying to get more sustainable funding to do this.
Yeah, I'm going to echo Natasha and Amanda again. My role, like I said, within the family health team, I work specifically with patients, but our social activities we've opened up to the community. And when, you know, some of our community members are coming in and they're expressing concerns to me, of course, I share any information I can with them on resources or other link workers that they may be able to connect with. Similar to if we have more funding to connect, to be able to expand, that would be ideal. It's just not currently happening.
Mm-hmm. And all those partners that Ali mentioned, Ontario Caregivers Organizations, Seniors Active Living Centers, 2-on-1, those, you don't need to be a registered professional to make a referral there. Anyone can make a referral to those organizations. And of course, if I had a magic wand, I would give everyone a link worker in every health setting and make sure that everyone has access to primary health care.
So the next question, it sort of builds on that, and it's, can we make social prescribing available, or would the model fit in different settings? So for example, long-term care, schools, colleges, universities, another magic wand moment coming in here.
Yeah, I mean, I think it would fit anywhere. it would be them having to maybe like, it would be amazing if there was community connectors in like every setting, because there's always further resources, supports, things that you can help connect and advocate, right? I think a big piece of this role is advocating for the clients and community members. And if someone is, I know here we have advocated for clients who don't have a primary care provider, and because we've been able to kind of create this circle around them, we can advocate, and sometimes we can get them in with one of our primary care. So no, I think it'd be amazing if there was, you know, I think of my kids' schools and families that could use more support. And if there was somebody at the school that the family could go and connect with to go, hey, I'm struggling like with food and I'm struggling with this, and we don't have, that could then connect them to resources in the community. Like, yeah, I think that'd be amazing.
Well, this program, if I can call social prescribing that, has already been adapted for different populations in different settings. And so maybe we can just put that out into the universe for different adaptation for social prescribing next.
Yeah, we've seen it work with different populations, with children, with youth, with older adults, culturally specific, nature prescribing, arts and culture. So I really feel like you can look at you can take a holistic view of a person in pretty much any setting, probably.
So the next question is around training and link workers and navigators. Like there's a lot of words kind of being talked about. And I'm not sure how similar link workers are with navigators. We had a question about, are there navigators that are at that particular location? So for example, the family health team, or are they available through the Alliance to support organizations? So could you maybe just talk about that a little bit?
Sure, maybe I'll start off and then feel free to jump in if you have other things to add. So, the benefits to being in with an integrated disciplinary healthcare team is that we're already working together in our settings of Alliance members. And so if there is, if some organizations are fortunate enough to have a link worker, sometimes it's the health promoter that takes that role on. And so, as was mentioned, that they can connect sometimes with non-rostered patients. And then in other settings, like, so for example, the Ontario Caregivers Organization has link workers that work regionally. And then I've noticed, so with some of the Ontario health teams, there's a navigator within the Ontario health team or in certain regions, and they might, their focus might be more on connecting existing partners of the Ontario health team with each other. So maybe you're seeing someone who needs mental health support, or maybe it's an older adult that needs to connect to a senior center. So making some of those connections. And I would say, yeah, that's my beginning of trying to answer that question. I don't know if others want to jump in.
I mean, I can kind of speak, like the title varies. It really depends on where you're at. A lot of the time it's at the very base, we're all doing the same work, right? We're helping people navigate the systems. We're helping people get connected to programmings, you know, kind of help following them to make sure they feel supported. Same thing, different name, really depending on where you're at. For myself specifically, like I do have that social work background, so I am able to provide more of that, like an increased level of support in our kind of one-on-one appointments. Other organizations I know, they kind of have that separated, like their mental health social workers versus their community navigation, which is specifically just to like, here's the community programs. If your space has that availability to do that, I am a team of one when it comes to the social prescribing piece. So it really depends on where you're at, what your community needs as well, is going to affect what you choose to call the position, what tasks are going to be taken on by link worker, community navigator, whatever you choose to call the role.
And I think just to add on to Allie's, the one big piece that I see different sometimes from when people say, well, we do this, is that check-in piece. It's that warm hand-holding. It's that soft hand-holding, like that we will go. We're not just like, here's the information. And then like, we're not really going with that, you know, or taking that journey with that client. Because sometimes it can take 6 months for somebody to get the confidence to actually go to a program. And we're not going to just like, oh, they're not going, we're done now, right? We've moved on. It is, and we really do have that kind of commitment to that client to be like, no, we're here to help you.
Okay, so we are running out of time with all these amazing questions. So I am going to answer the next question myself because you folks have already answered this and I learned from you. So the question is, can a prevention specialist engage in social prescribing, or is it solely the role of health promotion, and how can I apply it in my work? And I think what I'm hearing is that everyone can be a social prescriber. Many people already are social prescribers. They just might not attribute that name to it. And how to apply in the work. You talked about the online training, which I think is a great place to start in the community of practice, and maybe just making those community connections. I think those are some of the things that I heard already. And then the very last question is about numbers. Don't we love questions about numbers? So there were 28 sites, it seems, 100 clients per site. What is the main challenge in expanding this to reach more individuals? Because 3,000 Ontarians seems like a small number to start with.
Right. So I would ask for a link worker in every health setting. That would be one step to ensure that everyone is getting access to this kind of services. And that would be my first step.
We've all got our magic wands at the ready.
I think also
Well,
educating providers on the resources, right? Like I said, I'm fortunate I'm here within the clinic. Not every place has that, but having the providers aware, like, did you know that you can send your patient to the OCO? Sorry, I used that one because I talked about it yesterday. Right, making them aware of some of those bigger ones is going to really help kind of meeting more of the population that can't get connected to a link worker, health promoter, community navigator.
well, thank you, Natasha, Ali, and Amanda, so much for your presentation, for all of these terrific answers to your questions. I want to say a huge thank you to my PHO colleagues for their technical support. And of course, a special thank you to everyone who joined us for the webinar today. The recording will be posted in a couple of weeks along with the slides. And I do have to remind everyone that the Ontario Public Health Convention topic is coming up on March 26th and April 22nd. And you can view our website, tophc.ca, for details. And lastly, you are going to receive a brief anonymous survey about today's webinar, and we would so appreciate it if you could take 2 minutes to fill out that survey, because your feedback is important and it really does help us shape future events. Thank you again to our presenters, to you for attending. Have a wonderful rest of your day, everyone.